Good morning, Dr. Andy Kirshner here. As always, I'd like to thank you for joining me here on the Back Together blog. Today we're going to do a bunch of things which are essentially follow-ups. First follow-up, I want to thank everybody that sent all the nice comments about my daughter's blog post. She was really excited to participate in her daddy's blog, and it was just nice for her to see some of the comments. I really appreciate you sending them in. Also, an update on the fitness challenge. You may have read a couple days ago that my first weigh-in, I lost 2 pounds. I plan on keeping up everything that I'm doing, and I've been reading some of the stories that I've been getting from some of you about how you think that the excess weight has been affecting your back pain. I'm really looking forward to see how losing the weight helps you with your back pain. Now, I don't know if any of you saw this. Today, I got the Current Time magazine, and if you look, it's the most dangerous game. And it's basically a follow-up on the football injuries post that I did a couple months ago. The article focuses primarily on concussions, but it also does talk about the possibility of spinal injury, and actually gives a pretty tragic story of a high school student whose spine was fractured and became paralyzed as a result of a football injury. This is something that's going to get a lot of attention over the next couple of years. You know, football is a staple of American life. I wouldn't want to stop seeing football, and I certainly wouldn't want the kids to stop participating, but I think it's important that people are finally starting to pay attention to some of the inherent risks in the game. So I'm happy about that. I'm sorry that it had to be in the context of all these really bad injuries. As a Philadelphia Eagles fan and somebody who's worked with a lot of the Eagles, I really don't like seeing somebody like Brian Westbrook sustain a few concussions, and he's had a rough year as a result of that. So let's see where that all goes. Also, there's a follow-up on our post on pregnancy-related back pain. If you recall, a couple months ago, I did post a few posts about how pregnancy back pain is caused and some of the things that you can do to relieve it. What was nice is that there was a journal article in the American Journal of Obstetrics and Gynecology this past month, which basically supports the use of osteopathic manual medicine for the treatment of back pain during pregnancy. Now, this is important for one reason. There are a lot of physicians who don't recommend getting any kind of manual medicine during pregnancy because of the fear of throwing a woman into premature labor. And what this study said is that not only is it safe, but it's also useful in helping to reduce the pain. And this is a good thing because, as we know, pregnant women aren't or don't have the availability of a lot of the medications that other people would use to control their back pain. And of course, I always like to get away with treating back pain without medication if it's possible. Not that I have a problem with medication, but as always, the fewer magic potions you need to rely on, the better off you're going to be. In any case, I want to thank you again for visiting the Back Together blog. Thanks again for all your posts and comments. Send all your friends. If you know somebody with back pain, send them here because they're going to get some tips that will help them. Thank you for joining me, and I look forward to seeing you here on the blog.